I now get to work with the health systems to say, hey, you need to be treating young adults differently because we're not the same as a 4-year-old or a 64-year-old. And those are the average ages in pediatric and adult oncology, right? Someone who's 24 or 34 has really different needs and concerns.
Welcome to Adventure TED Chats. Today our guest is Alec Kupelian. Alec is Operations and Program Development Associate at Teen Cancer America. Alec, welcome to the show. We're very excited to have you here today.
Thanks so much for having me, Tommy.
Can you tell us a little bit about your work with Teen Cancer America?
I was always a big athlete, really took care of myself, and I was 19 in college when I pulled my groin. And I was playing sports at the time, and it never got better. In the meantime, I started to lose use of my left leg. I ended up kind of with this swinging limp, and I never went to the doctor. But something was clearly wrong, because by the time that I finally made it into the hospital, my muscles in my left leg had atrophied down to the bone, which means I really wasn't using that leg at all. My dad saw me changing one day and could see my body so dysmorphed. He was like, something's not right. And my dad is an oncologist himself. He's a cancer doctor. And so he had a good idea of what was up. So the very next day we went to get an MRI, and they found just about a football-sized tumor in my hip.
Oh my gosh.
Something that, if I had been better about going to the doctor when something was wrong, would not have been nearly as large as it was.
It was very fortunate that he caught that, and very fortunate to have a doctor in the family.
I know, and not everybody gets to have that, which is, one of the big pieces of what kind of my story is moving forward is, I spent 11 months in the hospital in treatment. During the next year, I received chemotherapy and radiation, and at one point I had the surgeon come in and looked at me and said, we're gonna take out your left hip, you'll never run again, you'll never walk normal again, but it's the kind of treatment that your body needs, and left. And that was really scary to me as an athlete. And my dad, who is an oncologist, was able to kind of pick through it and say, like, no, we want to try preserving quality of life. And we went with an aggressive radiation plan and removed surgery altogether, knowing that my treatment protocols, even if I did surgery, would have still required radiation. So I wasn't adding risk in that way. Because I had somebody who understood the system and understood how it worked, and I had somebody who was advocating for me, I was able to receive better treatment that was able to preserve the kind of life I wanted to live. And after treatment, I was able to go back to playing collegiate sports, which was huge for me in terms of getting back in shape after a year of bed rest and after using full use of my left leg. So I'm really grateful to have someone who could advocate for me in the health system.
That's great, and great that you were able to nearly fully recover and at least get back into sports. That's incredible. Absolutely incredible. On that note, I'm wondering, how do you feel that your experience connects with our overall message of helping others to overcome challenges and staying positive through life's ups and downs?
After my treatment ended, I was in a really bad place. I was really depressed and anxious, and I didn't have the words and understanding of my own feelings and emotions to understand where I was in place. I had a lot of deep-seated resentment at anything. It wasn't even specifically targeted to something. And I was really struggling. I started drinking and alcohol. I came out of treatment with a narcotics addiction. And it wasn't until my first suicide attempt, which surprised me, that I was like, I'm actually not okay. And I went to my healthcare team and I said, hey, I'm I'm not okay and I need help. Can you help me find a therapist? And once I asked, they were able to help me get the kind of care that I needed and the support that I needed in order to work through a lot of the stuff that I'd gone through. It turns out cancer's really hard. And I wasn't giving myself enough time and space to let myself have those feelings and understand those feelings. The hard part of it is that if I hadn't advocated for myself in those moments, my healthcare team wasn't going to follow up with me. They hadn't to that point. And I mean, by the point where someone has a suicide attempt, like, that's too late. We should be getting these people earlier and more often. And so when I hear that my story isn't unique, unfortunately, I knew that something had to be done. And the more I talk to young adults, the more everyone feels the same way. Like, we want to make it better for the next set of people who are going to go through treatment after us.
Thank you so much for sharing that with us. That's so brave of you, and honestly, so many people need to hear it. Because people do just feel, in a lot of cases, especially cancer patients, they can end up feeling so isolated, and it's important that we're able to have these honest conversations with one another and discuss these sensitive subjects that are really deep. So thank you so much for bringing that up and mentioning that. So who would you say through all of this has been your biggest supporter?
For me, instead of it being one person, it's my family. It's my parents and my sister. And interestingly, I feel like they all took on kind of a different role in my life and in my cancer treatment and in my mental health moving forward. My dad really, of course, took all the clinical and technical and mental health stuff. My mom handled a lot of the day-to-day needs that I was having trouble managing for myself. And my sister was kind of that same thing, that escape. She got to be my person, my friend. She was one of the few people in my life, and I highly recommend that. Never treated me different, didn't give me kind of kid gloves, was willing to tell me the boring gossip and the little issues, which were still valuable to me. It didn't have to be like, oh, you got cancer, so my problems are nothing. She was really she let me feel like a normal person as opposed to a cancer patient. And so while, there's a ton of things that have to be worried about, a lot of details that have to get figured, I was really grateful that my sister was there as someone who was just like, hey, you're still my brother, you're still a normal person, like, let me treat you that way, let me be that with you. So I'm really grateful to her and my parents as well.
It's excellent that you have that anchor and that you can be that anchor for other people as you move on your path and help others to overcome the same challenges. So how did that lead you to Teen Cancer America? And can you tell us a little bit about what it's like working there?
So I was 19 when I was diagnosed, but I was treated in a pediatric facility, and I was actually treated in a specific area for what they call adolescents and young adults. And medically, that sits in the 15 to 39 age range. And it was actually sponsored and funded by Teen Cancer America. And that's how I first got involved with them. And working with them since then, I learned that AYAs, these adolescent and young adults, have some of the worst outcomes in cancer, regardless of diagnosis, because their needs are different and they sit kind of in this in-between space in the healthcare system. So I started with them just initially as an advocate, as a patient, and as a survivor who was saying, hey, it really mattered to me that I was treated next to people my own age. And I was treated by people who knew my own needs and spoke to me as an adult, as the adult that I was and understood of myself.
So that's really inspiring, and what an amazing path that you took towards helping people who are also going through similar struggles in the way that you did, who can sympathize better. I think it's really important to be able to relate to them and for them to be able to relate back to you and see someone who's been through it as sort of like a light at the end of the tunnel, and that if you stick through it, you can come out the other side. Incredible work. What is it like to raise awareness for adolescent cancer at Teen Cancer America?
Yeah, it's a really unique space. Teen Cancer America is a hospital-facing charity, so I spend most of my time working with the hospitals to help them better create referral pathways and supportive care services to make sure we're treating kind of this whole person that has cancer and not just the cancer itself. Sometimes doctors get so head down into the survival and the treatment of it that we kind of forget a bit about the overall person who's getting treated and all the other pieces to health that we know cancer and cancer treatment can affect. And so what's really remarkable to me is how much compassion and understanding there is in this space in the healthcare system. The more that I speak, the more people go, oh, that makes a lot of sense. Like, what can we do? How do we get better? And we've seen this kind of collaborative network happen across sites in the institution. And the way the healthcare space isn't always as cooperative as it is competitive. And so I've been really grateful to be a part of this space, advocating with and for young adults. At the beginning of my treatment, if I had done a better job of admitting to myself and asking for help and saying like, hey, I know something is wrong, I could have gotten my treatment earlier, my diagnosis earlier, and my disease wouldn't have been as bad, which meant my treatment wouldn't have been as hard and my late effects wouldn't have been as long, and all these pieces would have come down the line. When I was, in a bad place mentally, like I had to ask for my own help and say, hey, I need these things along the way. Now that I work at Teen Cancer America, I realize how many more services I could have asked for, should have asked for, and didn't know about because nobody told me about them. And so again, being my own advocate, and now that I have follow-up appointments saying, actually, I want to go over all these points too.
Yes.
And then thinking about kind of how I now get to work with the health systems to say, hey, you need to be treating young adults differently because we're not the same as a 4-year-old or a 64-year-old. And those are the average ages in pediatric and adult oncology, right? Someone who's 24 or 34 has really different needs and concerns. And so I think this process of like really being able to say like, hey, here's what I need and I need help. Can you help me? Is one of the most important pieces to difficulties and challenges, and saying like, it's okay, you don't have to do it alone and you shouldn't do it alone.
Absolutely. And I think that younger audience members or people who are at the early stages of their pediatric cancer or adolescent cancer journey should know that it's okay to ask for help as you go through this challenge, and to be your own advocate first and foremost, and to recruit as much support as you can to help you through the process, because you're worth it. You are worth it and you deserve it.
Absolutely. More voices speak louder than one. And where I'm at now, again, I get this really unique kind of large picture view of what the field of oncology looks like now. And I get to work with hospitals, and I'm seeing the work that I do actually make tangible change on a national and now international scale. I just got invited to Chile to speak about how can they help their young adults with cancer. We're having over 350 clinical, I think it's actually now over 400 clinical professionals from around the world coming to LA to hear of Teen Cancer America. And we've put together this 4-day conference, medical and scientific conference for these clinicians to bring back to their areas in the world. So it's been such a value to me personally, but we're able to kind of give that voice back to young adults around the world.
That's amazing, and we're so glad that you were able to be your own advocate and that you had such a bedrock to lean on during such a difficult time through a cancer journey, and that you're making such a huge difference in the lives of others now. It's incredible, and we love to see it. We love seeing it scale and impact more and more people. It's a beautiful thing.
I view myself as really just another piece in the chain, right? Somebody helped me, and then I get to help somebody else, and I'm sure those next people will help someone from there. And I'm here because of the support that I was given, and so hopefully I get to be some of the support that will get somebody else up to the next place.
Absolutely, and nothing is more fulfilling than seeing those ripples go through the world and pay it forward We really appreciate you paying it forward here with us and sharing your story here today with everyone. I really do appreciate it, Alec. It's been a pleasure chatting with you. Thank you for coming in and sharing your story with us, and we can't thank you enough for being so open and vulnerable with us. And it's a really important story that a lot of people need to hear. And thank you so much for joining us. I really appreciate it.
I really appreciate you having me, Tommy.